A very good morning to everyone. I am Dr. Chirag Chamria. I am an Oral Maxillofacial Surgeon practicing with Royal Dental Clinics since the past 4 years. So friends, I would like to introduce to you something which we have seen either ourselves or our parents, grandparents, relatives. A lot of people suffer from this. It is called as snoring. So friends, why am I talking about snoring today and how is it related to maxillofacial surgery? So friends, snoring, why does it happen? So when we sleep, due to the gravitational pull, our tongue falls back and the space in our throat for the air to pass reduces. When this space reduces, our body inspires air or takes in air with pressure. Because it takes air under pressure, there is a noise which is created, and this noise results in snoring. What happens because of this? Now imagine if you were breathing and I obstruct your airflow, or I stop your airflow, I reduce your airflow. Wouldn't you feel suffocated? This is what happens during sleep. If you suffer from snoring, it is actually you are getting choked in your sleep. Most of the people who suffer from snoring would not have any short-term issues. They would be fine, they would have a good sleep. But in case if you feel that you are having less of the energy in the mornings, or you are sleepy throughout the day, or you yawn throughout the day, or if you keep on getting up in the evening and feel shortness of breath, then we should get it checked further. So what should we get checked? So first, something we call as a sleep study or polysomnography. In polysomnography, one tube is connected, a mask is connected, and the patient is allowed to sleep. In the night, the number of times this airway collapses is calculated per hour. When this number is greater than a certain point, then we need to undergo further investigations with X-rays and endoscopy. Sometimes nasal obstructions could also be a trigger factor for this problem. Now, say we have got our sleep study done, we got our X-rays done, and we are sure that yes, it is something called as obstructive sleep apnea. Obstructive sleep apnea would mean that there is something obstructing the airway, causing breathlessness during sleep. So what should we do? The first and the most conservative modality is lifestyle changes. Reducing weight is one of the most important factors because there is a lot of fat which gets deposited behind the tongue, and this fat would then reduce the airway space. The second other alternate would be to have something called as a CPAP device attached during sleep. This device, although cumbersome, but is a very good modality for patients who can live with this treatment. What CPAP does, it gives a continuous pressure on our throat so that the airway remains open and then normal breathing can happen. Although this requires a mask and a tube connected to the machine which will be kept near to the bed, which is its drawback. Do we have some other permanent solution for obstructive sleep apnea? Yes. There are certain surgeries which can be performed, which are routinely performed, and what they will do, the aim is to actually create a greater airway space. So this airway can be constricted due to the position of muscles which are attached to the lower jaw or the position of muscles which are attached to the upper jaw. So if we were to physically get the upper jaw and the lower jaw pulled forward, or tighten the muscles in this area, or reduce the amount of fat and muscles in this area, we would achieve the desired result of a greater airway space. But the decision to move the jaw, remove the muscle, tighten the muscle or remove the fat is taken on the basis of the position of the jaw, the muscles and the throat. which would require further investigations with X-rays. So friends, if you snore or if you know anyone who snores, it is better you get a maxillofacial or a sleep consult done, which will in turn increase the quality of life and also the duration of life. Thank you.